Top 6 vitamins to help clean fatty liver. Fatty liver disease is a condition where excess fat builds up in your liver cells, causing inflammation and damage. It can be caused by various factors, such as obesity, diabetes, alcohol consumption, or genetic factors. Fatty liver disease can lead to serious complications, such as cirrhosis, liver failure, or liver cancer. But don't worry, there are some natural ways to help you fight fatty liver disease and keep your liver healthy. One of them is to include more vitamins in your diet that have anti-inflammatory, antioxidant, and insulin-sensitizing properties. These vitamins can help reduce fat accumulation in your liver, protect your liver cells from oxidative stress, and improve your glucose metabolism. So without further ado, let's get started with the top 6 vitamins for fatty liver disease. Disclaimer: this video is for educational purpose only, so speak to your doctor if you have any medical concerns. 1. Vitamin E. Vitamin E is a fat-soluble vitamin that acts as a powerful antioxidant in your body. It can help protect your liver cells from free radical damage and inflammation caused by fatty liver disease. Vitamin E can also improve insulin sensitivity and glucose tolerance, which can lower the risk of type 2 diabetes and metabolic syndrome, both of which are associated with fatty liver disease. According to a study published in the New England Journal of Medicine, vitamin E supplementation improved liver function and reduced inflammation in patients with non-alcoholic steatohepatitis, NASH, a severe form of fatty liver disease. The recommended daily intake of vitamin E for adults is 15 mg or 22.4 international units, IU. You can get vitamin E from foods such as sunflower seeds, almonds, olive oil, spinach, avocado, and broccoli. 2. Vitamin C. Vitamin C is another water-soluble vitamin that has antioxidant and anti-inflammatory effects. It can help scavenge free radicals and reduce oxidative stress in your liver. Vitamin C can also boost your immune system and prevent infections that can worsen fatty liver disease. A study published in the Journal of Clinical Biochemistry and Nutrition found that vitamin C supplementation reduced serum levels of alanine aminotransferase, ALT, and aspartate aminotransferase, AST, 2 enzymes that indicate liver damage. The recommended daily intake of vitamin C for adults is 90 mg for men and 75 mg for women. You can get vitamin C from foods such as citrus fruits, strawberries, kiwi, bell peppers, tomatoes, kale, and parsley. 3. Vitamin D. Vitamin D is a fat-soluble vitamin that plays a vital role in calcium absorption and bone health. But did you know that vitamin D also has anti-inflammatory and immunomodulatory effects? Vitamin D can help regulate the immune system and prevent excessive inflammation in your liver. Vitamin D can also improve insulin sensitivity and glucose metabolism, which can prevent or reverse fatty liver disease. A study published in the World Journal of Gastroenterology showed that vitamin D deficiency was associated with increased severity of fatty liver disease and higher levels of inflammatory markers. The recommended daily intake of vitamin D for adults is 15 micrograms or 600 IU. You can get vitamin D from foods such as fatty fish, egg yolks, cheese, mushrooms, and fortified dairy products. You can also get vitamin D from exposure to sunlight, but make sure to use sunscreen and avoid excessive sun exposure. 4. Vitamin B12. Vitamin B12 is a water-soluble vitamin that is essential for the production of red blood cells and DNA. It also helps maintain the health of your nervous system and brain. Vitamin B12 can help prevent or treat fatty liver disease by improving your metabolism of fats and carbohydrates. Vitamin B12 can also lower the levels of homocysteine, an amino acid that can cause inflammation and oxidative stress in your liver. A study published in the European Journal of Clinical Nutrition found that vitamin B12 deficiency was more common in patients with non-alcoholic fatty liver disease than in healthy controls. The recommended daily intake of vitamin B12 for adults is 2.4 micrograms. You can get vitamin B12 from foods such as meat, poultry, fish, eggs, dairy products, and fortified cereals. You may also need to take supplements if you are vegan or vegetarian or have a condition that affects your absorption of vitamin B12. 5. Vitamin A. Vitamin A is a fat-soluble vitamin that is important for your vision, skin health, and immune system. It also has antioxidant and anti-inflammatory properties that can protect your liver from damage caused by fatty liver disease. Vitamin A can also modulate the expression of genes involved in lipid metabolism and inflammation in your liver. A study published in the Journal of Hepatology found that vitamin A deficiency aggravated liver injury and fibrosis in mice with fatty liver disease. The recommended daily intake of vitamin A for adults is 900 micrograms for men and 700 micrograms for women. You can get vitamin A from foods such as liver, eggs, dairy products, carrots, sweet potatoes, spinach, and mangoes. 6. Vitamin K. Vitamin K is a fat-soluble vitamin that is essential for blood clotting and bone health. It also has anti-inflammatory and antioxidant effects that can benefit your liver. Vitamin K can inhibit the activation of hepatic stellate cells, which are responsible for producing collagen and scar tissue in your liver. Vitamin K can also prevent the accumulation of fat in your liver by activating a protein called AMP-activated protein kinase, AMPK, which regulates lipid metabolism. A study published in the Journal of Nutrition found that vitamin K supplementation improved liver function and reduced fibrosis in rats with fatty liver disease. The recommended daily intake of vitamin K for adults is 120 micrograms for men and 90 micrograms for women.